Don Selzer, and I'm from Indianapolis, Indiana, and I became involved with the college in 2007 with our chapter in Indiana, and I've become involved on the national level with the legislative committee in 2011. I don't think there's any argument that our practice is overrun by the amount of administrative burden. Even in our practice where we have one administrative professional that works with one surgeon, those administrative professionals can't keep up with the amount of regulatory material that they have to deal with. We then have to include a nurse many times as well as a medical assistant in the clinic just to address some of the routine issues that we're trying to overcome so that we can provide care to our patients. I think that the regulations are excessive in how they impact our patient care. If I could give an example, so I'm currently trying to provide care to a patient who is suffering from reflux, gastroesophageal reflux, and poor gastric function, stomach functioning. And I want to be able to perform a surgery that I think will be very beneficial to treat these problems. And when I submit the surgical codes that I want to use, the insurance company interprets it differently than I interpret it. So they initially deny care, and then I'm offered a very narrow window of opportunity to appeal. And if they turn down that appeal after one appeal, then there's no opportunity to be able to offer that care. I was hoping to do it laparoscopically, minimally invasively with small incisions. Now I have to go about offering it through a large incision, which they approved, but now the patient is suffering because I'm no longer able to perform the operation with a technique that would allow for a faster recovery and an overall better outcome from the patient. I have to make a big incision that's going to lead to a lengthier recovery, potentially additional complications associated with that, all because of the regulatory burden associated with dealing with the insurer. Clearly, one of the issues here is to make sure that care is appropriate, and obviously regulations have an impact on determining appropriate care, and that's understood. Unfortunately, many times when we make rules, we have unintended consequences, and I think in this circumstance, we're creating barriers to care, and unfortunately, we're having negative impact on patient care that could lead to worse outcomes rather than better outcomes. I think the biggest thing that regulators don't always appreciate is how the rules that they initiate actually impact patient care. And I think what ACS, American College of Surgeons, can do is gather information, gather examples of how specific rules are impacting care negatively so that they can share that with the rule makers so that they can then make changes and lead to better care overall, appropriate, better care for our patients. I think the ACS is one of the most powerful organizations in surgery to provide this opportunity to collate this information and be able to give a voice to this that's going to be heard here in Washington, D.C. and in Baltimore.